So then let's finally end our episode by any few pointers for gynecology residents who would want to take up fetal medicine, or any pearls of wisdom for the already present gynecologist if they need to refer to a fetal medicine specialist.
I don't know if I'm that old to give pearls of wisdom, but I can say one thing, that if you want to be a fetal medicine person, you have to be an emotionally invested person.
Okay.
See, this is not a speciality where you should come thinking that, overnight I'm going to be a success, overnight I'm going to make a lot of money and I'm going to be rich and famous. അങ്ങനെ വിചാരിക്കരുത്. This is a specialty where you have to be emotionally invested in the fetus. There will be more setbacks than success initially. And if you are emotionally strong enough to hold those setbacks, you can take up this process. Most of the times, ആൾക്കാർ fetal medicine എടുക്കണമെന്തിനാ? Obstetricians especially now, this maybe obstetricians might not like. I've told my fellows also, ഇവർ fetal medicine എടുക്കുന്നത് night calls അവോയ്ഡ് ചെയ്യാനാണ് mostly. ഒരു obstetrician's life is very busy. നമ്മൾ night calls എടുക്കണം, delivery എടുക്കണം. This is the glamorous part of obstetrics. You can do scans, you do procedures, you go back home.
Right.
Nobody is going to bother you. You are leading a life inside an air-conditioned room. You don't have to run to the... But that is the outside picture. But the inside picture is, whenever you do a scan and you tell that this baby is okay or this baby is not okay, you're taking a huge risk on the life of that patient, day in and day out.
Right.
And if you're willing to live with that, okay, I am making a decision for a particular life. If you are willing to live with that, and if you are able to emotionally be able to come to terms with those feelings, then take up fetal medicine. Don't think that, okay, it's an easy job. And I mean, you can do other professions also where you have very good success rates.
Right.
For example, laparoscopic surgery and all is very good. If you're a good, skillful surgeon, it's a very satisfying field. You can absolutely do and excel in that field. But in these cases, sometimes you will have borderline cases.
Right.
For example, recently we had a case. Testing was done on the fetus, and for that fetus an abnormality came out on genetic testing. A genetic report that the baby had possibly Kabuki syndrome, which is a very rare syndrome. Our report ആയിട്ടാണ് patient നമ്മുടെ അടുത്ത് വരുന്നത്, and it is a genetic proof that the baby is abnormal. We did the scan is completely normal. But we told them that the scan looks absolutely fine. This finding that I'm seeing here is dangerous. Okay, that means this child could have some problem. But before we do anything else, let us test the parents. So we tested the parents, and the mother was carrying the same mutation. Means even though it was a dangerous mutation, it was not going to affect the child.
No.
And we told them to continue the pregnancy. But that takes a lot of risk. In our minds, again, there is that fear. ഇത് ശരിയാണോ, ഇത് പ്രശ്നമാവും എന്നൊക്കെ ഉണ്ട്. But then we took the decision based on the evidence. And sometimes hard evidence will tell us that we should take a strong stand. And അപ്പോൾ നമ്മൾ പേടിച്ച് if we play the safe role. Safe എന്താ? Terminate ചെയ്യുക. ആരും അറിയില്ല, ഒന്നും അറിയില്ല, കഴിഞ്ഞു. You are safe, everything is safe. But that is not the right decision. Invariably, decisions have to be made. And those decisions are going to be hard. And if you're emotionally strong enough to take hard decisions, take it. That's the only aptitude you need.
Okay. So I think what I could understand from this, I think good communication,
Yes.
honest communication, counseling, and be empathetic.
Yes, very, very,
Yeah.
very, very important. Because